In this clip, we have a look at the case study of a child, Arman, who's age 7, who presents with dyslexia. And the way his presentation is described is he has symptoms that are very widely observed with children with dyslexia. It talks about the referral process, how he's identified, and the steps that are taken to support him. It also looks at the research around best practice with supporting children with dyslexia. So about using structured literacy interventions, and then looking at using multisensory strategies and techniques. So when you look at the video, or after looking at the video, have a think about whether it would change how you would approach supporting a child with dyslexia in your class. So this is a student called Arman who's 7 years old. So he presents with difficulty with sounding out and decoding words. He's becoming more aware of his difficulties, and he's starting to avoid reading tasks. He is a child that would say that he hates being asked to read aloud in the classroom, and it's causing him some anxiety in phonics and literacy classes because he's afraid of his teacher asking him to read aloud. So when we see a student like Arman, how can we support him, or what kind of things should we be thinking about? Well, first protocol, I suppose, would be to refer him to, if you have a special education needs coordinator in the school, that he's flagged as someone who's potentially at risk of a reading difficulty, and that he can be assessed and we get further information about his profile. He may be already being seen by speech and language therapy or occupational therapy, and can they give us any insight into things? When we get that diagnosis completed, it gives us a much more specific overview of that child. So for Arman, perhaps he has very good verbal reasoning, but he might struggle with working memory. And he may be diagnosed with our reading difficulty, which we can term as dyslexia. And if that's the case, then what kind of supports can we provide to Arman in the classroom? So research shows that the best protocol or approach to follow is structured and frequent literacy intervention. And again, it will depend on what's available in the school that you're working at, or where that child is going to school. But research shows that frequent and regular intervention is better than, for example, doing a 2-hour block 1 day a week. If you can space that out as 30-minute sessions frequently in the week, we see that the child is going to make better progress that way. Research also supports the use of multisensory intervention, so that the child is getting input from maybe the kinesthetic, the way they move their finger or their body, so that when they're maybe tracing out a letter in the air, or they're using shaving foam or paint or different crayons, markers, pencils, paintbrushes. So they're getting different sensory input as they do the activity. They're hearing the sounds, they're seeing it on the board. They're seeing the teacher say the sound and emphasizing the way that she makes the sounds with her mouth. For example, when she's reading things out. Some literacy programs link up a visual action with the sound, and that's also another multi-sensory input. And what we see is that when we provide children with input through their different senses, it helps to establish different neural pathways in the brain, and it can help children to learn new things and help with their recall and retention of that information. What we also see as beneficial when we work with dyslexia is working on targets to fluency. Again, we may decide to follow the same protocol of learning sounds as the other children in the class are following. And your school may be using, for example, Read, Write, Ink. Maybe they're using Jolly Phonics for the early years. Maybe they have another reading program that they're using. And there's actually about 40 different programs that are recommended in the UK as appropriate for schools to use. So it doesn't, that there's many good programs out there. What we might decide to do then is to take the sounds that the rest of the students are working on and work on those targets until they're fluent. And then when the fluency is achieved, through that repetition and repeated practice, we will move them on to the next area. It's also a good idea to think about the meaning that children attach to sounds. So, based on the science of reading research, it states that not only should we work on the structure of sounds and words, we also should work about its overall application to everyday life and other contexts, so that we build our understanding of the words we read and its application and generalization to other areas. So then what that means for us is that we want to look at seeing those words come up across lots of different topics and areas. It could be a short reading comprehension task. It could be picking an activity that the speech and language therapist works on with, for example, if you're working on S sounds, can we incorporate that into lots of different S words in silly sentences or associated with S type pictures? And then that the child is seeing it in maybe in their English class done in a particular way, that it's incorporated, or in maths that the teacher emphasizes the S sounds that come up in that task. So again, we're trying to make the links across all the different subjects so that the child has a greater likelihood to practice it, and in that way we build fluency.